Well, hello, everybody. Welcome to another edition of BackGenius. Of course, I'm your host, Dr. Mark Morningstar. And on this week's topic, or this week's show, we're going to talk about BackGenius. Of course, as you've known for several weeks now, BackGenius is the main sponsor of the Scoliosis World podcast. And again, I thank you for tuning in this week. But I wanted to shift gears a little bit because there are a lot of people who are still sort of unfamiliar with exactly what BackGenius is. A lot of them might take BackGenius supplements, and they're sort of familiar with the concept, but they don't really know what it is. So this podcast episode is really just as much for doctors out there learning about BackGenius as it is for the general public wanting more information. And just to give you some background on it, I think the most important point to get across in this podcast is that BackGenius's mission is to allow doctors of whatever type, MD, DO, DC, PT, ND, any doctor who has a desire to work with the scoliosis population should be able to do so from the most comprehensive perspective possible. And I say that because, as you hear me talk about on every episode, scoliosis is far more than a spine condition. In fact, the curvature that we see on an x-ray is not representative of the entire condition. It is simply the musculoskeletal symptom of the condition, or at least the main musculoskeletal symptom of the condition. And when you look at it that way, it becomes very obvious that it takes a whole host of clinical tools, clinical decision-making, clinical reasoning, clinical diagnostics to come up with a treatment plan that looks at scoliosis for all of its facets. For example, we know scoliosis has digestive components related to it. We know that scoliosis has bone density components related to it. We know that scoliosis has genomic components related to it. We know that scoliosis has hormone and neurotransmitter components to it. And if you don't treat all of the components, the patient in front of you is going to have a lesser chance of having a good clinical outcome. Now, in light of that and in the spirit of that is really how BackGenius was born. I hope that all practitioners out there, regardless of their background, want to have as many tools in their toolbox as possible in order to best deal with the condition called scoliosis. And there are a lot of tools out there that help it in various ways. And I think it behooves every practitioner to want to learn all of those ways so that they can take the patient in front of them and devise an appropriate yet comprehensive treatment plan that incorporates everything pertinent to that particular patient. For example, take as one tool that everybody's familiar with scoliosis hard bracing. The reality of hard bracing is that it's not necessary for every single scoliosis patient. There are some that it's vital for, and there are some that it might actually make their curve worse. Just depends. And so the nice thing about a brace is that it's a tool, and you have to be very judicious on when and when not to use a rigid brace. Just like you have to be very judicious on when and when not to use, for example, a scoliosis activity suit, or when and when not to refer for surgery. Just because a person is at a certain threshold doesn't necessarily mean they're a surgery candidate either. And therefore, BackGenius is a means of giving providers every single tool, all of the clinical rationale, and making BackGenius doctors the absolute best version of themselves insofar as treating patients with scoliosis. I think it's starting to become a little bit outdated that doctors are known by a particular method they practice. I don't want doctors to be known by the fact that they prescribe a certain brace or that they prescribe a certain type of an exercise routine. The reality is, as scoliosis providers, we should know all of those things. And we should know how to take all of those things and take bits and pieces out of whatever we think is going to provide the patient in front of us with the best, most appropriate treatment plan for that individual. Because the reality is, I could line up 10 patients in front of me who all have the exact same scoliosis x-ray virtually, And yet they will all require different types of exercises or bracing or treatments because everybody's different and everybody has different components attached to their scoliosis. Some people tend to have a little bit more pronounced hormone presentations with theirs. Some have a little bit more neurotransmitter emphasis. Some have a little bit more robust digestive issues. So you have to take the person in front of you and deal with the most obvious clinical underlying contributions to their curve. So that's really sort of the crux of BackGenius, right? So with BackGenius, we strive to sort of be on the cutting edge of all things scoliosis, meaning research, meaning treatments, meaning diagnostics, just patient management in general. And I'll give you some easy examples of this. It has been known since the 1980s, mid-1980s, that scoliosis has a genetic or a genomic component to it. Now, some of the research is still trying to play itself out into which genetic variants are the most impactful, which ones are the most predictive, and so forth. But everybody takes as self-evident that scoliosis has a genetic component or a genomic role. But the problem is very, very few practitioners actually attempt to take that genomic data and that genomic information from that person to try to predict what is it about this person that may have contributed to his or her scoliosis. And hence, what can we do about those underlying genomic risks to mitigate the chance that that curve will worsen on its own as a product of natural history, assuming we do nothing to mitigate the genomic risk. And we see this all the time. You take any other disease process and everybody is pretty on board with the concept that if I can prevent something from happening, that obviously is the best way to go. I don't want to wait till I have my first heart attack. Ideally, I'd like to prevent my first heart attack. Well, if I have a mild curvature, I would like to know what factors do I presently have that will allow my mild curvature to progress to a point where now further treatment becomes necessary or more invasive treatment becomes necessary. I don't want to wait until it already gets there. That's why it bothers me that we even have in 2026, that we even have a stage of care called observation only or watch and wait. I don't care how mild a curve is always worth treating, even if that simply means addressing things about the person that try to prevent that curve from worsening. I wouldn't just do nothing. As an easy example, a study published in the journal Children a couple summers ago, 2023, I believe, showed that just giving kids with mild curves calcium, vitamin D, and melatonin, that their curves did not worsen like other kids who were in the normal watch and wait protocol. So why would anybody ever want to do watch and wait? And frankly, I think most parents don't want to do watch and wait or observation only because they don't want to sit there and physically see or watch their child's curve worsen. It makes you as a parent feel powerless to help. But there are ways to help, and that's what BackGenius teaches. It's not just about waiting till a curve hits 30 degrees and now throwing a brace on it. There are many more things involved in scoliosis. But the problem is the options from a conventional perspective haven't really changed in the last 70 years. Now, we might have a couple of new surgeries that are much less invasive, which I'm all in favor of. But the reality is the management in general of idiopathic scoliosis has not changed. And BackGenius aims to fix that. So we train our doctors to collect as much information about that patient as possible, so that when we construct that patient's management plan, we are using a wide array of treatment options. We are using a wide array of diagnostics. That way, we can develop the single most comprehensive treatment plan for that patient, period, bar none. Even if that patient ends up needing surgery, there are still things that very frequently need to be done for that patient to help ensure that their surgery has a good long-term clinical outcome. It's not enough to just say, well, you're going to have fusion surgery. There you go. I fused your back. Your curve is 70% better. Have a nice life. That's not true. There are just as many people out there who have had fusion surgery who are in terrible shape, who had the surgery and are in amazing shape. You can go on any social media and read just as many people think it was the best decision they ever made as compared to people who say it was the worst decision they ever made. Why? Because there are things about each individual that allowed that curve to get to that point. And those things don't just go away because that teenager who had surgery now becomes an adult. Those things are still there trying to cause a certain adaptive response that we call the spinal curvature. And unless you mitigate those things or resolve those things, they are just going to keep stimulating the body to create that adaptive response. And it's why we see a lot of people over the long term whose fusion surgeries that the rods bend or the rods fail or the rods break, and revision surgery has to be completed. Well, what if we could spare people revision surgery because we took basic preventive aspects about the condition and we actually dealt with them? That's what BackGenius teaches. Now, BackGenius has a lot of its own tools. BackGenius obviously uses its own scoliosis activity suit, which has been around for a long time. BackGenius also uses its own line of nutrients, which are predicated upon a lot of very precise diagnostic testing that is a little bit more scoliosis focused. We now are also getting into, and have been for the last year and a half, into teaching doctors how to do rigid bracing on their own. You know, historically, chiropractors and PTs haven't had a lot of access to be able to prescribe rigid bracing for their patients because they haven't had the knowledge or the availability of such treatments to be able to offer to their patients. Well, now there are doctors and PTs who are chiros and PTs who can do those things through BackGenius. Another thing we're getting into is laser therapy. In fact, I was recently on an Acupuncture Today podcast, and we discussed laser acupuncture at length and how combining laser acupuncture with Schroth therapy actually substantially boosted the benefits of the Schroth therapy a year later compared to people who just did the Schroth therapy by itself. Now, does that say it's going to work for everybody? No, of course not. But it's another tool that BackGenius doctors can learn to effectively handle the patient in front of them. Not only that, but laser therapy, or something called biophotomodulation, especially when it pertains to central nervous system or brain-based things, laser therapy can be a very powerful tool at helping to increase the production of some of our main neurotransmitters within the brain. So rather than to have a person just take certain nutrients or supplements to try to improve their neurotransmitter status, now there are other more targeted therapies that we can use to directly affect the natural intrinsic production of those neurotransmitters, which is fantastic. In fact, most of that research has been pioneered by the fields of neurology and neuropsychiatry. Fascinating. So we want to teach that to all of our BackGenius doctors as well. So we have a number of therapies that we keep trying to pioneer, acquire, pirate, if you will, because now there are therapies out there that maybe haven't really been thought of as scoliosis therapies. But in reality, there are several therapies out there that have the opportunity for highly successful scoliosis patient outcomes as well. Not only that, but orthotic intervention, meaning, insoles for different orthopedic issues of the ankle or the foot, and pronation and flat feet and etc. Things that do also contribute to scoliosis progression. Not only that, but in the dental field, there are different types of cranial therapies, palate expansion, all kinds of things that are also known, and going back even into the late 1970s in the dental research literature, to show associations between spinal curvatures and different cranial facial distortions or asymmetries. We owe it to our scoliosis population to figure these things out and to learn as much about all of these things as we possibly can so that we can best attack the problem for the patient in front of us. Not every patient is going to need laser therapy. Not every patient is going to need a rigid brace. Not every patient is going to need fusion. Not every patient is going to need some type of cranial orthodontics. However, there will be a lot of patients who need some of them, or one of them, or multiple of them, and in different combinations, because every person is different. If you go to a place that's doing a particular treatment, I don't care what that treatment is, and everybody is getting effectively the same thing, then they're not really providing you a customized treatment. They're just not. You have to be able to adapt your treatment plan to the patient in front of you. And at the end of the day, that's what BackGenius is trying to teach all of its network doctors. Now in BackGenius essentially limits the participation by member doctors to 2 doctors per state, with Florida, California, and Texas being the exceptions. But in every state, we want doctors to be able to serve as many people as they can in their respective states. And we want these doctors to become the absolute best at what they do. And so we have continuing education seminars for our BackGenius doctors, so that they are always on the cutting edge of all of this. We encourage our BackGenius doctors to participate in clinical research by having a practice-based research network. Again, these things are vital to move these concepts forward. So if you're a doctor out there, chiro, PT, naturopath, and you are looking to provide more for your scoliosis patients, or maybe, like me, you're considering converting your practice to a fully dedicated scoliosis practice, where scoliosis is pretty much all you do, BackGenius is where you want to be. To doctors who just want to be known for a certain method, I do Schroth, for example. Well, you'll notice there are all kinds of versions now of Schroth therapy, because everybody is trying to continually differentiate themselves based on the latest, greatest flavor of the month treatment system. The problem is the treatment system doesn't work for everybody. There is no single treatment system out there that works for everybody. Now, sure, you could argue there are some that work better than others, but I want everybody to have success. Therefore, the goal becomes really patient selection. The patient in front of you is most appropriate for XYZ treatment plan. That patient over there, they're more geared toward the ABC treatment plan. But yet, a BackGenius doctor can provide both of those plans because they're adept at providing as wide of a variety of treatment options as possible. We literally want BackGenius doctors to be able to treat and do everything short of surgery. And of course, leave surgery to the surgeons. Now, having said that, however, there are ways to make the surgery treatment work better as well, and to get better surgical outcomes. Curve flexibility, things that promote curve flexibility, things that, again, minimizing the underlying reasons as to why that curve developed in the first place. All of those kinds of things are what help improve patient outcomes from surgery. And BackGenius doctors can provide those things as well. So again, it has to be about the patient in front of you. And I want every BackGenius doctor, I want people who know them. I want BackGenius doctors to be known because their patients feel like they're the best at what they do, not because they practice a certain technique or a certain method. Because techniques come, techniques go. Everybody, just like I mentioned with Schroth, there's probably a dozen different versions of Schroth out there, just in the United States alone, and everybody's practicing it and doing it a little bit differently. It's not Schroth, and it's not whether you practice Schroth, for example. And I'm not picking on Schroth. It's just that that's the one that probably in the States most people are starting to recognize. But there are limitations of Schroth. And so what might work for this patient over here with Schroth won't work for that patient over there. So you have to have other treatment options to give that person to do either instead of or in concert with their Schroth. And knowing how to do that is really sort of the foundation of BackGenius, which is why in BackGenius doctors have the ability to achieve what's called Align certification. Align, ALIGN, which stands for the Advanced Laboratory Integration of Genomics and Neurohormones. Very, very powerful. And what that does is it allows every BackGenius practitioner the ability to really hone in on what is it about that person that allowed him or her to develop that curve. And based on that information, they can now develop and implement a treatment plan that addresses those underlying contributing factors, so that whatever physical treatment that doctor is recommending for that particular patient, that physical treatment is far more likely to be successful, not only in the short term, meaning the next 1, 2, 3, 4, 5 years, but in the long term, the next 50 years, 60 years, 70 years of that patient's life. Because remember, most of the time, these are teenagers. And I want their treatment plan to work well into their 70s and 80s, to the full life expectancy. I don't want the treatment plan to only work for a year or 2 or 3. Because again, if that's all it does work for, then we never really address the root cause of that curve in the first place. So BackGenius doctors are very, very comprehensively trained and undergo a lot of continuing education as part of the process. Now, patients, if you're listening to this podcast about BackGenius, you will know that BackGenius has its own supplement line, and that supplement line is really geared toward the scoliosis population in particular. Reason being, we've noted over time, and I've published many, many times, the difference in neurotransmitter patterns in patients with and without scoliosis. I've noted different hormone discrepancies and published different hormone problems in scoliosis patients versus non-scoliosis patients. Published differences in the genomics and the different genomic variants that scoliosis versus non-scoliosis patients have. And it's about using all of that information to determine how we can best benefit each patient. Now, I have a lot of patients who might see somebody locally who doesn't happen to be a BackGenius doctor. Maybe there isn't a BackGenius doctor in their local territory, local area. And so they continue to do some type of a physical treatment method available in their area, and yet consult with me from a virtual basis, because then that way we can still do all of the foundational workup on them remotely. And so it at least still allows people to get the care they need in a comprehensive fashion, even if they're not necessarily getting the physical treatment from me myself. Now, the reality is, if there is a BackGenius doctor in your geographic area, then I highly encourage you to seek that doctor out. And you can find all of the BackGenius doctors in the United States on the backgenius.com website. The last thing I would sort of leave you with for this podcast episode is I implore you to not just seek out methods. I really do feel like a lot of methods are being recycled with different names. I think there are a lot of methods out there that have been around for a long time, and new people learn them, new generations learn them, and they just sort of rehash them and they recycle them. Most physical treatment options are largely very similar. So I encourage you to find something that you're comfortable with, that you can maintain, that's near you, and BackGenius can take care of the rest. If you happen to be near a BackGenius doctor, by all means, visit that BackGenius doctor, because you will get very comprehensive care from BackGenius doctors. The one other aspect of BackGenius that I would like all of the general public to understand is that I strive to have BackGenius to be very much an evidence-based process. And that's, I think, at the end of the day, if I could make some type of a slogan with BackGenius, the biggest thing I want people to walk away from is the way BackGenius approaches scoliosis management is we are trying to fix the process in order to fix the curve. If somebody comes in with a curve, you can't just randomly push on the curve, whether it be through chiropractic adjustments or manipulation. You can't just push on the curve through wearing a rigid brace. It doesn't always work. And the reason why it doesn't always work is because there's something about that person and that person's physiology that required that curve to be there. And so at BackGenius, our job is to figure out the why of that equation and handle that underlying why at the same time that we're doing the physical treatment. So there you have it. BackGenius, fix the process to fix the curve. You can't just fix the curve without knowing what the process was that caused that curve to happen in the first place. Now, in 2026, what's really cool about BackGenius is we're also going to be launching what's called the Curve Watch program, teaching our BackGenius doctors little ways and little things, not just from a visible postural examination sense, but also from a functional laboratory sense on how to do things to predict what is the likelihood that a particular patient either has a mild curve or may develop a curve based on different laboratory and postural assessments and functional neurological assessments. So we teach all of these things. And with Curve Watch, it'll allow families who are concerned about their children because maybe mom or dad had a curve, or a grandma or grandpa had a curve, or an aunt had a curve. Somebody in the family has a curve, and so the parents are concerned that their particular son or daughter might also develop a curve. Well, this will allow BackGenius doctors to try to predict from much more than just an Adams forward bending test, for example, the normal bend forward, let me look at your spine, because the reality is that test alone is not very sensitive. And until the curve has already reached a certain threshold, in many cases, that bending test is not going to show positive. Well, this way, there are a lot of other things that we can do in order to predict what the chance of a curve developing is, or the chance that there's already a mild curve in existence that bending test alone would not discover because it's not sensitive enough. So the Curve Watch project is something that we organized at the end of last year, and now this year we plan to be fully implementing to get our doctors up to speed on scoliosis evaluation and be the best at it, frankly. To know all of the processes that allow the most chance of successfully predicting whether or not a curve will start in a given child if we do nothing to prevent it. So again, the idea being prevent a curve, not just treating an existing curve. That to me is the real crux of BackGenius. Getting it down to a science so well that we can establish whether a child looks like they're going to develop a curve, address all of the reasons as to why we think they are going to develop a curve. And because of that, we now prevented that curve from happening when they hit puberty. And that is an amazing accomplishment. And if BackGenius can reduce the onset of scoliosis even by half, BackGenius has done the world and humankind a favor. So with that, that's BackGenius in a nutshell. Remember, fix the process to fix the curve. I'm Dr. Mark Morningstar, your host of Scoliosis World Podcast. Thank you very much for tuning in this week. If you like what you hear, you like the podcast, please subscribe to our channel. And we'll see you next week. Have a great day.